Hey guys, this is Dr. Hub. Today we'll look at the WHO classification, and this is going to be of the plasma cell neoplasms. The plasma cell neoplasms. So to start with, we look at the plasma cell myeloma. So there is plasma cell myeloma. So there is non-secretory, there is secretory. So non-secretory means there is no secretion, and this is of the IG, and there is no M component. Next, what is involved is smoldering. So smoldering means it has the M protein. So smoldering has M protein, and in the serum it is greater than the 6 gram per dl, and or it is greater than 10%. And this is a clonal plasma. These are clonal plasma cells, and this is present in the bone marrow. And there is no related organ or tissue impairment. There is no related organ or the tissue impairment. Next, under this there is a plasma cell leukemia. So plasma cell leukemia, there is greater than 20% of the plasma cells. So greater than 20% of the plasma cells, and it is present in the peripheral blood. It is present in the peripheral blood or the absolute plasma cell count, and this is greater than 2 into 10 to the power 9 per liter. Next, we look at the plasmacytoma. The plasmacytoma. So plasmacytoma, it is a solitary plasma. There is solitary plasmacytoma, and this is a localized tumor of the monoclonal plasma cells. It is a localized tumor, and this is of the monoclonal plasma cells. The monoclonal plasma cells, and there is no clinical feature of the plasma cell myeloma. There is no clinical features of the plasma cell myeloma. Next, we look at the extramedullary plasmacytoma. There is the extramedullary, that is a extraosseous plasmacytoma. So this includes the localized plasma cell neoplasms. So there is a localized plasma cell neoplasms, and they arise in tissues other than the bone. Arise from tissues other than the bone. Next, we move on to the monoclonal immunoglobulin deposition diseases. The monoclonal immunoglobulin deposition diseases. So what does this include? There is a primary amyloidosis. So the primary amyloidosis is there is a tumor secreting the light chains. There are tumors secreting the light chains, and they are deposited as a beta pleated sheet structure. There is beta pleated sheet structure, and there is amyloid light chain. Next, we move on to the systemic the systemic light as well as the heavy chain diseases. The systemic light as well as the heavy chain diseases. So they secrete an abnormal light. So what they do is they secrete an abnormal light as well as the heavy chains, or both. So which do not form the beta pleated sheet. So they do not form the beta pleated sheet, and stain the Congo red. And what it does, it stains Congo red as well as contains the amyloid P component and contain the amyloid P component. Next we move on to the plasma cell neoplasms. So as far as the plasma cell neoplasm, it is associated with the paraneoplastic syndrome. So it is associated with the paraneoplastic syndrome, and under this there is a POEMS syndrome. So POEMS means it is POEMS syndrome. So what is the expansion? The expansion is that it contains, there is polyneuropathy, then comes the organomegaly, next there is also the endocrinopathy, then the monoclonal gammopathy, as well as there are some skin changes. Next there is also the involvement of the TEMPI syndrome.